Well, we normally think the biological clock only ticks for women, but more studies are revealing that a fertility clock is counting down for men too, showing alarming rates of genetic abnormalities in older men's offspring. Joining us this morning is Dr. Harry Fisch. He's director of the Male Reproductive Center at New York Presbyterian Hospital at Columbia University, and he's the author of this book, The Male Biological Clock, a book everyone's talking about. Dr. Fisch, thank you so much for joining us.
Good morning.
The conventional wisdom has always been that we men don't have to worry about this. We can have children in our 40s, our 50s, even our 60s if we find a willing partner. But you're finding research that proves that that's really much more complicated.
Absolutely. You know, we age like everybody else, like women age. Every cell in the body ages, and there's no reason to think why the fertility clock doesn't tick down. It ticks down for men just like in women.
In what ways does it tick down?
Well, you know, when we say a biological clock, which I talk about in my book, The Male Biological Clock, we say that there's a decline in fertility, a decline in hormones, and an increased chance of genetic abnormalities associated with older sperm, which is similar to what's happening to women.
Now, is there an age when this starts to kick in?
Well, it's interesting. We don't really know. We don't really know, but it appears that after age 30, there's a decline in hormones. It starts as early as age 30.
I'm shocked when you say that because I thought you were going to say something like 55.
No.
So you're saying after age 30?
That's absolutely correct. After age 30, and it gets worse and worse. You have to take care of yourself early on, but you got to remember, it gets worse and worse as we age.
Let's look at some of the health risks that you associate as men get older and are having children. Down syndrome. How much does this increase the risk of Down syndrome?
It's amazing that we always thought that Down syndrome was a product of older women.
Right.
And now we know it's a parental thing, that a man's sperm is responsible for about half the cases of Down syndrome in women over the age of 35.
And we should talk about the specific risk here is the fragmentation of DNA.
Absolutely, absolutely. There are other factors that really come into play as well, other genetic abnormalities as well.
Schizophrenia.
Absolutely. That's an incredible sort of disorder. That's not a very mild sort of a very rare condition. That actually occurs quite frequently.
And then one that has been much more diagnosed, much more frequently, has been very much in the news, autism.
That's right, autism and autism-related syndromes. And that's about a 6-fold increase in men over 40 compared to men under 25. That's a real concern.
What about the risk of miscarriage? I mean, obviously, this is a greater risk for women as they get older. Is this a risk for men, too?
Well, it's something that we never knew before. All of a sudden, it's not just a woman's problem. Infertility and miscarriages is not just a woman's problem. Men's sperm are responsible for these sort of disorders and miscarriages.
I looked at some of the research, though, and they said that one criticism of people say, well, it's starting younger, is that the data is all over the books for men. There's some men are having children successfully in their 50s, and other men are having difficulty in their 30s.
That's correct. Different men have different clocks. Some clocks tick faster than others. In general, I mean, if you have a problem when you're younger, it's going to make it worse when you're much older. But the clock does tick for everybody.
And you suggest the clock can be turned back a little as well.
That's where we're going with this. Not only are men now understanding that there's a clock, but there's something we can do about it. There's a lot of things that can really turn back the clock.
What are some of the things you can do, obviously?
Well, you know, you must have heard this a lot, diet and exercise.
Right.
That's the thing that's very important. It turns out that if you have a big belly, fat around the stomach, you have a lower testosterone level. That means men who have a bigger belly have a lower testosterone level than men who don't.
Stay away from smoking.
Absolutely. Smoking is awful. It's bad for the blood vessels in the heart. And guess what? The blood vessels in the heart are similar to the blood vessels that affect fertility and sexual function.
I've got to ask you one final one, because I thought this was, as they say, the old wives' tale. Stay out of hot tubs. Is that really true?
That's absolutely true. Anything that's excessively hot around the scrotum and everything could be hot, but not too hot. And those things can adversely affect sperm production and testosterone levels.
So you just want to make sure you stay in good shape as best as you can.
Of course.
Okay. Dr. Fisch, we want to thank you very much. Your book is out there, The Male Biological Clock. And you can find more helpful suggestions on improving male fertility by logging on to our website, WNBC.com. Darlene, back to you.